Hi, and welcome to What's Happening at Tri-City Medical Center. I'm Kellie Davis, and I'm your host for this edition of What's Happening, made in collaboration with KOCT, North County's channel, and the Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local medical center and provide you with information on a healthy lifestyle. Joining us on our show today is Dr. Gehann D'Souza, a cosmetic reconstructive surgeon who is here to talk about facial aging, breast augmentation, and migraine surgery. Welcome to the show, Dr. D'Souza.
Thank you, Kellie.
D'Souza.
D'Souza.
Yeah. Got it. So, you know, where are you located? And I have to ask this question first. Why did you choose cosmetic surgery? Where'd you go to get your training?
Thank you so much for having me, Kellie. I'm a plastic surgeon in the Carlsbad Oceanside Vista area, and I serve all of Southern Orange County, Northern San Diego, and the San Diego County regions. I've been in San Diego for the last 4 or 5 years. I worked at UCSD Medical Center as a plastic surgeon, and I also spent a year at the Cleveland Clinic and Johns Hopkins University to get some of the training in plastic surgery.
Fantastic. And when you went to medical school, there's so many things that you probably were interested in, you could choose from. Why this particular profession?
So I think plastic surgery enabled me to give patients a full depth of care. You know, plastic surgeons are not like the urologist or heart doctors. We work on the entire body. And so I can do a case in the scalp the same day as a breast case and the same day as a hand case. And so it gives us a very diverse portfolio and enables us to really help patients in a very diverse set of manner.
Wonderful. So one of the first questions I'd like to ask and talk about facial surgery, what are some of the signs that of facial aging?
So, you know, facial aging occurs in very specific set points. And once you're in your 30s and 40s, you might start to see fine lines and wrinkles, and you start to see them in the crow's feet area. You start to see them in the glabella region, you know, the number 11 lines that patients tend to see. You also start to see deepening of the nasal labial folds and deepening of the jowls. And when we look at the face and we see how the face ages, the face starts to drop in a counterclockwise and a clockwise position. And so your face, basically, the fat in your face starts to deflate, and your face starts to drop and gets tethered by ligaments that are held to the bone in your face. And that's why you get these lines in certain areas of the face.
Is it because they're trying to keep holding it up? Is that what it is?
Exactly. What we always say is that gravity always wins. And so your face starts to drop in the same manner, and the ligaments hold the face where they should have been, but it doesn't end up working.
I see. And so what are some non-operative treatments for facial rejuvenation?
Of course. So, you know, I think the general public knows Botox and fillers. Those are the two main non-operative treatments. The third non-operative treatment is laser rejuvenation. So when we talk about Botox and fillers and laser, they're all three different modalities used to treat different aspects of facial aging.
So when someone comes to you, since there's three different, say that again, there's three different modalities
yes,
of which
three different treatments in facial aging: Botox, fillers, and laser treatments.
So what would be your recommendation? I mean, why would you tell a client Botox over fillers? How do you choose?
So it's not as cookie cutter as just telling a client one thing, second or third thing. What we end up doing is we sit down with the client, we start to see the client's goals and needs and how much time they want to have off and recover from each of these treatments. We also want to see how much work the client wants to put in each of the treatments. You know, the Botox, fillers, and laser each have different kind of time span of recovery and cost associated with it.
That's interesting that you said work. So let's take something like Botox. First of all, exactly what is it, and what is the work that you just said that's involved with
Botox
that?
is the easiest thing. Okay. It requires no work. So Botox is a nerve chemo de-innervator, which means what Botox does is it paralyzes muscle. And so these lines all over your face are formed because muscle contracts and causes the skin to contract in the same way. So if you paralyze the muscle temporarily, like Botox does, it gets away it takes away those lines for a certain period of time, about 3 months.
And one of the things some of my favorite actresses, and I will not speak their names, back in the day I really enjoyed them because of their facial kind of expressions. And now I see them, is there a limit of when you should stop doing Botox so much?
Well, there absolutely is a limit. There's a happy medium everybody needs to realize. And you can't just paralyze your entire face, because then you end up having a very stoic plastic kind of face. And so you need to go to a real plastic surgeon who knows how to deal with this, who's not just gonna pump as much product into the face, but you need to go to somebody who has an artistic manner about them that can balance everything and do what's right for the patient.
So with Botox in particular, there's you would recommend there's probably a limit to keep going back.
Absolutely.
And what do the fillers do?
So what the fillers, we say fillers are plumper uppers. So what
Plumper uppers.
Exactly. So what fillers do is when your face ages, your face deflates. And so the fat in your face starts to go away. So if you look at your pictures when you were younger, maybe 15, 20 years old, your cheeks were up here, and your cheeks have kind of sagged and deflated as you age. And so fillers actually plump up your cheeks to a more youthful appearance. It also kind of softens some of the lines that you have in your face, as far as the lines near your nose, the lines near your jaw.
And comparing to Botox, that would be a little bit more work, a little bit more time?
It's still not a lot of work. Okay. Botox and fillers are done in the plastic surgeon's office, and it takes maybe about 5 to 10 to 20 minutes.
Okay. How would someone know if they're ready for this kind of treatment, a facelift?
People need to realize that, with Botox, fillers, and laser, those treatments have very little downtime. With something like a facelift, the downtime is about 1 to 2 weeks, depending on how in-depth of a procedure you want. So that's the question people really need to answer. They need to balance the downtime with how much effect they want.
And the incisions for something like a facelift, where are those?
So the incisions are very well hidden. People come to me all the time and are worried, number one, about the incision. But the incisions are basically disappear in a couple years. The incisions are hidden in the hairline, behind this part of the ear called the tragus, behind the ear and back into the hairline as well. And so you really don't see the incisions, especially if you have long hair or if you have, well-placed incisions.
Okay. And how long typically would you say a facelift lasts?
A facelift, we say we give a facelift about a 10-year warranty. And in 10 years, you're going to come back and say, my facelift looked absolutely fantastic, but aging still happens after the facelift. We can't just stop the aging process with the operation. So in 10 years, we say, my face looks better than if I didn't have the facelift, but I maybe need a little touch-up.
Because as you say, gravity
always wins.
Thank you for this particular segment. And we will be right back with Dr. D'Souza to talk about breast augmentation.
Tri-City Medical Center, a leader in advanced healthcare close to home. Meet former NFL and 3-time Pro Bowl player Willie Buchanan. He retired after a decade in the NFL, but not before it took a huge toll on his knees.
I was in so much pain that eventually I wasn't able to do a lot of activities.
Willie realized that surgery was probably his last option and researched extensively who he would trust. He chose Tri-City Medical Center's Dr. Helgager, who performs about 200 total knee replacements a year.
Willie was experiencing severe pain from bone-on-bone wear in both knees. After consulting with him, his best option was knee replacement surgery. I knew this surgery could give him back his quality of life.
The surgery took less than an hour. I'm now pain-free and back to my daily activities, which include doing what I love best, playing golf. I'm so thankful for Tri-City Medical Center and their doctors.
Willie is just one example of how Tri-City Medical Center is dedicated to getting you back to doing what you love. Tri-City Medical Center, advanced healthcare for you.
And welcome back to this edition of What's Happening at Tri-City Medical Center. I'm Kellie Davis, and we've been speaking with Dr. Gehann D'Souza, cosmetic and reconstructive surgeon in Carlsbad, here to speak about breast augmentation surgery. You're located again at...
Kelly, so I'm located in Carlsbad, just right off the 5, and we serve all of Southern Orange County and Northern and San Diego County area. The practice is called Iconic Plastic Surgery.
Perfect. So at Iconic Plastic Surgery, we're talking breast augmentations. And one of the things that I find fascinating, so often people think of augmentation is that just to make your breasts bigger, but you can also reduce.
Yes, so there's an augmentation where you make the breasts bigger, fuller, and there's also the breast reduction. And in these cases, patients with breasts that are too large or drooping can have them reduced, and you can alleviate some of the neck pain, the back pain, the shoulder pain from large pendulous breasts.
So the augmentation does by itself means bigger.
Exactly.
And when you say breast reduction, obviously that means smaller.
Exactly.
Okay. And so what are some of the options for people who want breast surgery in general anyway?
So, you can make it bigger and you can make it smaller, like you said. So if you'd like to make your breast more full and have a more full look with more cleavage in a bra or in shirts, you can use a breast implant. And I know people have all sorts of questions on breast implants, so I brought some in today to show you.
I'm so excited. You know why? Because when will I ever get to play with breasts like this, you know?
Absolutely.
So what do we have here? It's the different kinds of implants, yes?
Right, exactly. So implants are divided into a couple categories. And I can go through the implants so everybody knows really quickly. Good. So implants can be smooth implants, as you can see there.
Okay, so this is a smooth implant, okay?
Exactly. Implants can also be textured, and if you feel the difference between the smooth and the textured, you can notice immediately how each feel.
Okay, this is going to be but feel for what? I mean, it's going to be under the skin.
Exactly. So let me get to that. So a textured implant sits in the breast pocket, and the breast pocket kind of holds the texturing in place. So why this is important is that the other category of implants are the shaped implants. And if you look at this implant versus this implant, the shaped implant has a breast contoured shape. And so some people need a shaped implant if they'd like a more natural curve to the breast.
So you're saying this one here is the one that's more natural shaped.
Exactly.
And it's also textured. And why is the texture part of it?
It's textured for a couple of reasons. It's textured because it holds in place. Because if you think about it, if you have a shaped implant, you want it to stay in one place.
It's good for it to do that.
Probably very good to do that. But if you have a round implant, it doesn't really matter if the round implant kind of moves around in different directions, which it really doesn't anyway, Kelly. So.
And this one here, what is this here for?
So
what is that?
This is a saline implant. So what these implants that I showed you before are filled with is they're filled with silicone. Okay. Silicone has a more natural feel to the implant, and you can kind of feel it yourself. Yeah. Saline implants are filled with just saline water.
And this would be saline.
This is
once it's
full. Right now it's filled with air. So.
Yeah. And so this would be considered the higher end, the
Well, it's not really higher end. So somebody who comes in and asks me for silicone versus saline, why would we make that decision? So number one, under 22 years old, we're only allowed to put saline implants in that patient. And that's kind of an FDA regulation.
May I ask why? I'm curious.
It's just one of the rules. So in the 1990s, the FDA really looked hard at the implants and all sorts of tests on the implants. And so this is one of the rules that the FDA has come up with for plastic surgeons. And so that's one of the reasons why we would put a saline implant. Another reason is, say a patient just doesn't want silicone, doesn't want to have to worry about anything with silicone. So the new 5th generation silicone implants, the chances that those will rupture or leak are minuscule. They're less than 0.05%. in the right hands. But it still could happen. It's a very small chance. So if somebody is worried about that very tiny risk, they can go with the saline. And if the saline ruptures, then you just have some water.
Saline solution.
Exactly.
And do you personally prefer one over the other, or is it really your client's decision?
So what we do is, at the practice, we sit down with the client, we try to find out everything we can from them. We learn about why they're coming in for this implant, what they want to accomplish, and we kind of take all measurements for their breast size and what they want to accomplish, and then we come up with the final decision with the patient.
I know that some, I know I have a friend of mine that had gotten a breast augmentation, and I was shocked to find out that, do you have to keep kind of going back in for I don't know if it's I don't know what's that, not a retuck, but do you have to continue to come back in once you have it once?
So we don't, so once a patient has a breast augmentation, we see them several times immediately after the procedure.
Immediately after.
Exactly.
The procedure.
And after 1 year, they don't have to come in again. But what happens over the years is your breasts start to age the same way any other part of the body starts to age. And again, gravity will always win. And then you would have to come back and we can reevaluate your breasts. Sometimes we may need to do something called a mastopexy, which is tightening the skin that has drooped around the implant a little bit more. Other times, we might need to put a bigger implant or a smaller implant in there. But we give it about 10 years after the first surgery where we'd like to see the patient back.
And a question that I've always wanted to ask, how does that affect like a young person who's 22 and gets a breast augmentation and then they're 30 and they want to breastfeed? How does that affect breastfeeding?
So breastfeeding is not affected by the implants. Patients can still breastfeed after they've had a breast augmentation. And it's really not affected very much at all.
Okay. And what is a recovery time to one of these?
So that's a great question. And what we do at Iconic Plastic Surgery is we have a very strict recovery model. And so what we tell patients, and the way we do our surgery, is a very non-invasive way to do surgery. So we try to avoid hurting the muscle and hurting the rib, which causes a lot of pain in patients postoperatively. We also do special nerve blocks in the operating room to kind of anesthetize that region. So after the operation, what we tell patients is they should be able to go out to dinner that same night or go out to coffee that same night. They will wear a surgical bra. The next day, they will take off that bra and take off some of the dressings that we have on. But the recovery time is very, very short, and it's not a painless operation, but we do certain things in the operating room that make it a lot less painful.
And you think you answered this, but about replacements for that, I think you said about that you don't necessarily have to have a replacement, or do you replace it?
Right, so you only need to have it replaced if you don't like the look of the breast further down the line, if your breasts have aged further after the initial surgery. You also have to have it replaced if you start to get things like a scar forming around the breast called a capsular contracture or other details like that. Otherwise, we like to see our patients within 10 years just so we can see how they're doing and we can just talk to them about what their goals are at that point.
Well, thank you so much for that. Breast augmentations. And we'll be right back. We're going to be talking to Dr. D'Souza about migraine surgery.
Did you know most men take better care of their cars than they do themselves? Nearly 26% of men 18 to 44 years old in the United States do not have a regular source of health care. Make an appointment today to ensure you stay healthy tomorrow. This message is brought to you by Tri-City Medical Center, advanced health care for you.
If back pain is keeping you from doing what you love, we want you to know about the Mazor Robotics Renaissance System, an innovation in spine surgery first offered in San Diego at Tri-City Medical Center. Meet Dr. Payam Moazes. Dr. Moazes is among the most experienced surgeons using the Mazor Robotics Renaissance Guidance System. This system is 99% accurate, requires a shorter hospital stay, is safer and less invasive. Recover faster. Get back to doing what you love. Tri-City Medical Center. Advanced healthcare for you.
Welcome back. Dr. Gehann D'Souza has been joining us to speak about the services he offers through Tri-City Medical Center at his offices at the Iconic Plastic Surgery.
Right, Kelly, Iconic Plastic Surgery. And so we have an office in Carlsbad, California, and we service all of Southern Orange County and San Diego.
What's interesting to me is that this is called Iconic Plastic Surgery, and this segment is talking about migraine surgery, and you see patients initially through this clinic. Why is that?
Absolutely. So migraine surgery is a brand new field of medicine, and it was discovered by plastic surgeons, and that's why plastic surgeons have really propounded this field and really taken it into the 21st century. And so what we used to see when we did plastic cosmetic surgery is that we would be releasing the nerves that caused migraine surgery during our cosmetic operations, and the migraine headaches would really go away in these patients. And so we did a lot of research in Cleveland, where I trained, about this field, and that's why we can offer this great treatment out to all our patients.
Because I think I heard before something like when is it because of, you were saying the Botox, that it would release a nerve or something like that?
So here's what happens, Kelly. So you have all these nerves that give sensation to the face. The nerves come from the brain through little holes in the skull and give sensation to different areas of the face. And so what happens is sometimes those nerves can be compressed or sandwiched between the bone, muscle, or fat. And so if you paralyze the muscle or cut the muscle out, the nerves basically lose that compression, and the migraines or the sensation diminishes and goes away.
So what is a migraine headache, and how does it, and who does it affect?
Right. So migraine headaches are these intensely painful headaches that affect 35 million people in the United States alone. 1 out of 4 households in this country have a member of the household affected by migraines. So it is a pretty big deal. Women get migraines more, older people also get migraines more, but migraines can affect anybody.
Mm-hmm. And what are some of the traditional therapies?
So some of the traditional therapies for migraines are pain medications like Tylenol, Motrin. You can also get specific migraine medications that affect the nerves on a really molecular basis. But these things only decrease the headaches or decrease the pain while the headache is happening. They don't cure the headaches completely. And that's where plastic surgery comes in for migraine surgery.
So when someone comes to Iconic Plastic Surgery, and because it's on your website that you do this service, could you talk me through what happens?
Absolutely. Yeah. So the first thing we make sure is that the patient has seen a neurologist, and the neurologist has to diagnose the headaches as being migraine headaches, because there are different kind of headaches that a patient can have. Once the neurologist has seen the patient and they come to our clinic in Carlsbad, what we do is we give the patient Botox injections. And then we send the patient home for 3 weeks with a little diary. And we ask the patients to write if they've had migraine headaches, what time of the day these headaches have come on, if the Botox helped the headaches, and where exactly on the face the migraines have occurred.
Oh, that's interesting. So what preoperative tests are required prior to undergoing this?
So like I said, number 1, they have to see the neurologist. Number 2, we inject the Botox, and they keep the whole diary throughout the Botox treatment time. And so those are the main preoperative tests. There's nothing more. They don't have to go through any CT scan. They don't have to take any really large invasive tests.
So I know that we spoke before that when you have Botox, sometimes people need to come and get that again. Is that a similar thing you found with the migraines, like it stopped for a while and then they had to come back in?
Absolutely. So the way Botox works is it paralyzes muscle. So if you paralyze a muscle that is compressing or sandwiching a nerve, then the nerve has room to breathe and room to live and won't be giving you the pain that can result in a migraine. But Botox only lasts for about 3 to 6 months. So a Botox treatment is only a temporary cease to these migraine headaches.
And what are migraine trigger points?
So migraine trigger points are those specific nerves. And so if somebody comes and tells me, oh, I get migraine headaches here, that's caused by nerves over here. If somebody tells me they get migraine headaches in the back of the head, that's caused by nerves in the back of the head. And so if we know exactly which nerves we need to target, then we can actually prescribe a surgery that deals with that particular nerve and that particular migraine.
So you would, if it's, let's say, in the back of the head, is that still Botox back there?
So there's Botox back there, and then the surgical option is we make a tiny little cut that's well hidden in the hair. We find the nerve, and we look, and we see, oh, this nerve might be sandwiched by fat, or this nerve might be sandwiched by muscle. If we can see that muscle and fat, we basically cut a little swatch of the muscle around the nerve and enable the nerve to be less compressed or sandwiched.
So in the case of I guess whether it's the back of the head or even the front, is that a surgery done by the neurologist or is it done by the...
So correct. So neurologists don't do surgery, and that's where the plastic surgeons come in. So the neurologists will tell us this patient is having a migraine. Then we take it on from there. And so what we do is we actually operate on that patient. We make the cuts in surgery centers or in the operating room.
So between the Tri-City Medical Center neurologists and you all decide where this is as a I guess together?
Absolutely. So we talk to the neurologists, we also speak with the patients, and we kind of all formulate a plan as to figuring out what's best and what's the best option is for this patient.
Okay. And you already said what migraine surgery is like. Is there anything that you would add to that, recovery time or anything?
So migraine surgery uses the same incisions as any other plastic surgery procedure. So in the front of the head, we use the same incisions as a brow lift. In the area of the eyes, we use the same incisions as a blepharoplasty or eyelid surgery. And so the recovery time is actually very, very quick. For the front of the head, it might be about a week. For these eyes, it might be 2 or 3 days. And for the back of the head, it might be about 3 to 5 days.
Okay. And what are the outcomes of this?
So we've looked into this extensively at the Cleveland Clinic and in Cleveland where I trained. And the outcomes were in 80% of patients, in 5 years, their migraines completely went away. And their migraines were kind of dissipated in these patients.
So you would say that it is a success.
It's an absolute
way.
success.
Okay. Well, we want to thank you so much for joining our show, Dr. D'Souza, Dr. D'Souza, and we want to thank you for all the work that you're doing there in Carlsbad, for sure.
Okay, thank you, Kelly.
And thank you for joining us. You've been watching KOCT's What's Happening at Tri-City Medical Center. To view past episodes or for more information on KOCT's programming, visit koct.org. I'm Kellie Davis. Thank you for watching.